Zhang, Archie, MMC General and Stroke, UHB Stroke. Let me see those faces. How can we get them to turn their videos on?
I have no control over anything. Genevieve, turn your video on.
Zhang's having trouble
This
with the
is
camera.
for you to solve next year. How to mandate.
Johannes will be on top of that.
Zhang says he has trouble with the camera, sorry.
You're excused, Zhang.
Thanks for answering.
Thank you. Johnny, can you turn your video on, please? Hey, Archie.
Hi.
Hey.
Genevieve was overnight, so I think it might be fine if she doesn't turn her camera on.
Okay. All right. That's totally fair. Hey, Ashley. Hey, Carrie. Hey, Y. Yukyung, Dylan, and okay, awesome. Hey, everyone. All right. So some of you participated in the OSTEs in December 2021. It's been a year and a half already. Hopefully they were a positive experience and they weren't scarred into your memory, but we're going to do them again. So we're doing them on May 8th, 9th, and 10th. So we are going to do it a little bit differently this year. We're going to split up the OSCEs. So this year we're going to do OSTEs, and I added a few OSCEs as well. So there's some clinical cases in addition to teaching cases. And we're splitting it up into the PGY classes. So each class is going to go on a different day and have 2 stations. So the PGY2s are going to be doing a teaching case plus a 1 minute, with a 1 minute preceptor format. And I'll go over that today. And I'm also going to email out just like a 1-page quick PDF on the 1 minute preceptor. Hey, UHB Stroke, hey, Mohammed. And there'll be a second kind of like surprise case because people love surprises. PGY3 class is going to be a feedback case, and it's going to be as well a diagnosing a functional neurologic disorder case. So it's going to be a case of a patient who has what we think is a functional neurologic disorder. So your tasks will be to do a very quick motor exam in the legs, and then to deliver that diagnosis to the patient and talk about a treatment plan. In preparation for that, I'm going to email out to the class some information about functional neurologic disorders, how to communicate to patients that they have a functional neurologic disorder, and a little bit of information about performing a motor exam or an exam in general in a trauma-informed care way. Which is a way to examine patients who may have been through some trauma in the past, and to really examine with empathy and to examine in a careful way where you're asking for permission, where you're not potentially causing worsening trauma during the exam. So there'll be some reading for that one. Please do the reading before the OSCE because that'll prepare you for how to do it. The PGY4s are going to have another feedback case. And in addition to that, they're going to have a delivering bad news case. So this is going to be delivering bad news. It's going to be delivering news to a family member about a patient who had a very large intracerebral hemorrhage. I know we've done this a lot on the floors, but I really want to introduce a new method of how to deliver bad news. And it's using something called Spike's protocol. So on Monday, We have a guest from Cornell in the palliative care department who's going to be giving a talk on how to deliver bad news. So please attend that talk on Monday. And you're going to be using what she teaches, and you're going to be using that format to deliver bad news during the OSCE. Okay. Anyone have any questions? Okay, cool. So
Wait, we have a question.
yeah, cool.
Okay, try again.
Yeah, that's better.
Conference be recorded on Monday?
Are the OSCEs recorded? Or is the lecture recorded on Monday? Yeah, it should be. Sure enough, we can record on Monday, right?
It will be me. I will try to record.
Yeah. We'll ask the faculty from Cornell if she's okay with that, but I can't imagine she would say no. It's Jamela Raymore. She's really excellent. Any other questions? Okay. Did everyone attend my lecture about this stuff a year and a half ago before the first OSCE? If you did, I'm sorry, because we're going to do it again. But it's been a year and a half, so the chances are you probably don't remember any of it. So let's begin. Can you raise your hand if you did attend that lecture? I just want to have a general sense of who is there and who this is completely new for. And if you don't remember, you can not raise your hand. So Liz, you were there. Cool. Anyone else? Srinath. Everyone else, it's new? Okay, cool. Archie was there. Excellent. Okay, so this will be a review for all of you. Let's talk about resident as teacher briefly. One second, sorry. Okay, can you see my slides? All right. So objectives. So we're going to talk about why resident as teacher curriculums are important. We're going to learn the 1-minute preceptor to effectively and efficiently teach when things are hectic. This is meant to be something that allows you to teach very quickly in 1 minute, although it probably takes longer than 1 minute, but it doesn't take longer than a few minutes. And learn how to use the self-reflective feedback conversation to give effective feedback. All right. So think about your favorite teacher, right? Yakov and Siska, other favorite teachers. What characteristics have your favorite teachers had in common? What's made them a great teacher?
Easily approachable.
Easily approachable, yeah. Yeah, not intimidating. Any other thoughts?
Breadth of knowledge.
They actually know things. They have things they can teach you. They have good breadth of knowledge. 100%. Other ideas?
Wait.
They
Yeah, they can hear you now.
they admit when they don't know things, and they walk you through their thought process of trying to figure things out.
Yeah. So they're not just like giving you random facts. They're working on, they're really reinforcing clinical reasoning, and they know their limitations. Just like a good doctor who knows their limitations and who admits when they don't know things.
Open-minded to our suggestions and take them seriously. Don't just look for an answer in their brains.
Right. Medicine's often not just one clear answer, right? Just because they're thinking about something doesn't mean that other answers are necessarily incorrect. Absolutely. So They're knowledgeable, they're enthusiastic, they're accessible, as Liz mentioned. They actively involve the learner, as Dylan mentioned. They help the learner expand their skills. They give direction and feedback. They know their limits, which was mentioned, and they're a good role model, right? So these are all things that we should try to do as teachers. It's always great to think about how to be a good teacher, because you can all think of who have been good teachers in your life. So why is teaching important? It's enjoyable, or at least some of us think it's enjoyable, but I think a lot of us do think there's some enjoyment in teaching. It's required. The ACGME actually says that residents should be teaching. When you're going to be faculty, a lot of you are going to be teaching residents and medical students. And now, whether you enjoy it or not, you have medical students all around you. And so they, as medical students, would say that they spend the most amount of time with the residents. They look to you as role models. So you make a really big impact on their education. And a lot of what you do actually determines what field they're going to go into, whether they like neurology. You would be surprised how important your impact is. A lot of times more than attendings. Teaching helps you retain knowledge. And I think that's 100% true. I tend to learn stuff if I have to give a lecture on it. Before that, I know things, but I gain expertise by having to teach it. I had a few years without residents, and since I've been working with you all, I would say that my understanding and my ability to kind of synthesize knowledge has certainly improved. When you know you have to teach, you just you become more of an expert. Some general tips to improve teaching. Before seeing a patient, prime the student, right? And this happens all the time. A student's going to go see a patient with a headache. Prime them. Let them know what should they be asking, what should they be looking for, what are some important things to think about. Because if they go in blind, that might be a little, they might get a little less out of it. When seeing patients, just think out loud. If you're already thinking about what the differential is, when the student's there, just talk about it out loud. If the patient's there and you're thinking that ALS might be the diagnosis and you don't want to say that out loud in front of the patient, that's reasonable. You can do that afterwards. But in a lot of cases, just talking about your clinical reasoning out loud is enormously helpful for the student. For each case, even if it's really hectic, think of like 1 or 2 teaching points. Use the 1-minute preceptor. Students will take it all in. If you have one thing to teach them, they're going to be so appreciative, even if it takes you 20 seconds. So really just try to get it in there. Get students involved, ask them questions, make it as active as possible, right? And don't just ask facts. I think when I started teaching, when I was a resident, when I was an early attending, I was very into asking facts. I was like, what are the 3 most common localizations for hemorrhage, upper hemorrhage? And I would ask that. And I was like, yeah, I'm a great teacher. And I'm involving the student. And that's important. But the heart of it is really clinical reasoning. It's coming up with a differential. It's trying to localize. Because facts, at the end of the day, the students are going to be able to Google that in 2 seconds, right? And they have that ability. We want to teach them how we think. We want to teach them how to think critically about problems. This is really hard because sometimes the student's presenting a case and you're like, and you're like, this is disorganized. This is unhelpful. I have no idea what's going on. If it's really bad, you might need to interrupt them. But a lot of times, if you're having questions, try and reserve those questions till the end. And let the student finish the presentation. A debrief is always helpful. So whenever you see a patient, debrief with the student, even if it's just a minute or 2. Ask them what they think is going on. Ask them how that was for them. Sometimes they're difficult conversations, right? And just say, how was that for you? That was hard for me. And just get their idea of what they're thinking. I'm sure they have questions to ask. Just reflect on it. Okay, so this is the 1-minute preceptor that we're going to go over. It's 5 skills that's done very quickly. So the first thing is that the resident or the learner, so the student for you all, or a junior resident, is going to present a case, right? So that's not included in the 1-minute preceptor. Archie, I can't tell if you have a question or your hand is still raised from before. I think your hand is still raised from before. If you have a question, just pipe in. So the first thing is they're going to present a case. And then you have these 5 skills. Number 1, obtain a commitment, right? Ask them, what do you think's going on with this patient? What's the diagnosis? Or if the diagnosis is clear, what should we do next? You want to get the student to be actively engaged. You want them to become thinking about the issue, right? One way we think about student learning is called RHYME, where a student is a reporter, an interpreter, a manager, and an educator. And in the clerkship years, it's more than just reporting. They should be a reporter. They should be able to get a good history and physical and report it out. But the 1-minute preceptor is really focused on actually getting them to critically think, right? Number 2, probe for reasoning. Get them to talk out loud about why they think a certain diagnosis is the case. That actually allows you to diagnose them. So that allows you to diagnose where their knowledge is and what you need to teach them. Number 3, teach a general rule. Just teach like 1 or 2 general rules about the diagnosis. Number 4, give feedback and reinforce what was done correctly. Be specific about that. Number 5, correct any errors. So just a little bit of just constructive feedback on what they can improve. So what, why, thought process, do this again, don't do this again. Okay, great. So let's do an example. Chief complaint, 51-year-old woman presents to the ED with episodes of loss of consciousness, HPI. So they're presenting this case. So let's see, who wants to volunteer? Or who wants to be voluntold? All right, I will volunteer Ashley. Thank you, Ashley. Yay, Ashley. All right, I'm going to be the student. I'm going to present. I want you to do the 1-minute preceptor on me, okay?
I remember now.
51-year-old.
Sorry, say it again. Where I have like my phone and the computer, so I manage so that you can see us. So I'm managing the audio on both. Can you just repeat what you said?
Yeah. So I'm going to be the student and I'm going to present this case and I want you to do the 1-minute preceptor on me.
Okay.
All right. You're going to obtain a commitment. You're going to probe for reasoning. You're going to teach a general rule. You're going to reinforce what I did well, and then you're going to correct any errors. Okay. You're going to be great. I'm excited about this. So, 51-year-old woman presents after being found at home by her partner. The partner was in a nearby room and heard a loud noise coming from the kitchen. The patient was on the floor and had urinated on herself. Since the patient has woken up, she's been confused. She had head trauma when she was 18, suffering a concussion. She doesn't take any medication. She has no past medical history. She drinks wine socially, doesn't use any illicit drugs. And on exam, her pulse is 112, her blood pressure is 130/95, and her neuro exam is normal. Dr. Becker, what's going on? That's the history.
Okay, so go back to your other slide. What does obtain a commitment mean again?
You're going to ask me. You want me to be the active learner here. So I just want to be a reporter a little bit. I just want to be like, that's the history. I don't know what's going on. So you want to obtain a commitment and actually push me to say, what's the differential? What's the possible diagnosis here?
Okay, so let's summarize summarize what you just told me.
Okay. So 51-year-old woman who was found unconscious, had urinated on herself, and she's been confused since she woke up. normal neuro exam.
Okay, so what, what's going through your head? What do you think? What's your first impression?
I'm not sure. I mean, so maybe she's syncopized. I guess she could have had a seizure as a possibility. I don't really know.
Okay,
Probe for reasoning or supporting evidence.
so you said maybe she had a seizure. So why do you think this could be a seizure?
I guess she was confused afterwards and she urinated on herself, and you see that with seizures.
Okay, great. Yeah. Okay, what?
Teacher general.
Okay, general rule. So yeah, that is really good. We do see people. You guys can't laugh at me. Stop laughing. So we do see, we always do ask about urinary incontinence when that's one of the classic questions we ask when someone's having a seizure. Some other things that we can ask are, how long did the seizure or how long did the activity last? We ask them maybe to act out what they saw. We ask the patient if they remember anything. And yeah, those are some rules.
Okay, great. And what did I do well? Reinforce what I did well.
I think you gave a really organized presentation of the patient that you saw, and which is great. I think that you summarized it really well. And I think you got a pretty good history of what we can tell so far.
Well, thank you, Dr. Becker. And is there anything constructive that you can give me feedback on?
I think you did great. I would, go back and maybe ask this patient a few more questions, try to get a little bit more history from the family, so that we can really try to get the details of what happened. So you just want to have a really clear timeline and the best picture that you can get of the event.
Yeah, that's really good constructive feedback, getting some collateral and asking some more questions. I think that's really great. How was that, Ashley? How was doing the 1 minute preceptor?
It was fine.
Good. I think you did a great job. The one thing I would say is that when you're obtaining a commitment and probing for reasoning or supporting evidence, you kind of were like, oh, you said syncope for a seizure. Why seizure? Make me commit. So just say like, which do you think it is? And if I say syncope, then ask why. It would be really great to know why I thought syncope, and then you could teach why it's seizure instead of kind of like directing me towards the right answer. Does that make sense?
Yes.
Okay, that was excellent. Thank you, Ashley. That was great.
You want to make them, think as if they were a resident or attending.
Yeah, and don't lead them in one way or the other. Let them think, and that helps them.
Okay.
And then you can diagnose them. You can figure out what their thinking is. Excellent. Anyone have any questions about the 1 minute preceptor? You're ready for doing it? All right, PGY2s, you're going to do it. It'll be great. All right. 6 is plan. So I forgot about that. So come up with a plan. So is there any reading that the student can do? Is there any studying that they can do to kind of learn about this case? That's also important. Okay, let's talk about feedback. So I'm going to skip this. We can skip that. But just think about it. recently have you worked with an attending? How much feedback did you give? Or were you provided? And how useful was the feedback? Think about whether you had any feedback at all, right? We are working on having attendings give more feedback, but this is a problem throughout medical school, throughout residency, that people don't necessarily learn how to give feedback. And so a lot of times people don't receive feedback. And if they do receive feedback, it's not necessarily very helpful. So when we talk about feedback, we're going to talk about defining, recognizing why it's important, describing some strategies, and I'll show you a few videos on that we can all interpret how the feedback was, what could be improved. So what is feedback and what is it not? It's so we have a definition here. So information provided to learners with the intention of narrowing the gap between actual and desired performance. I would actually change this definition slightly. This used to be the old definition of feedback, right? The teacher is providing the learner with feedback. The way I would change it is that it should really be generated with the learner. So the way we think about feedback now is that it's really a conversation, hence the reflective feedback conversation. And it's really beneficial for the learner to be involved, to self-reflect, to think and assess on their own how they're doing, to recognize what they could work on. A lot of times they know. And first of all, if you just tell them and they're not an active participant, they may dismiss it, they may get upset. But if they also kind of think about it themselves, they'll take it to heart more. So this should be generated with learners. Feedback is a formative assessment, right? The purpose is to encourage learners to reflect, to strategize, to reinforce strong and change weak skills or behaviors. It should be ongoing. It should occur all the time. It's not a one-time thing. It can be formal. So this can be like at the end of your rotation, you're getting feedback, or mid-clerkship feedback, right? So this is like 2 weeks into the clerkship, that's 4 weeks long, you're giving feedback to the student. Or it could be informal, like the student does some exam and you're watching it and you just give very informal feedback on what they can improve or what they did well. It should really be given before a summative evaluation, right? They should be given formative feedback so they know how to improve. So feedback's contrasted with an evaluation, which is a summative assessment. That's at the end, that's like a quiz or a test. That's meant to be a grade or to rank people. It's often formal, standardized, and high stakes. So a formative assessment is feedback. Feedback is not a summative assessment. Another way to think about it is a summative assessment is an assessment of learning. A formative assessment is an assessment for learning, right? So the OSCEs and the OSTEs that we're going to do in a week and a half, those are formative assessments. It's for all of you to learn. We're not judging. We're not grading you. This is really to learn. Why is effective feedback important? I think a lot of you already know this, right? Trainees want feedback. 96% of 1,500 residents, this was surveyed in 2004, and I think that people recognize how important feedback is more now than compared to 2004, believe that feedback's important for learning. It gives trainees an accurate perception of their milestones and competencies. As I mentioned, it really allows for directed self-reflection, and it inspires goal setting so people know what they should improve on and how to improve. Do we need to discuss how to give feedback? Yes, of course, right? What's the feedback that you've received? You've received good job, great job, good with patience. You're always so professional. You have a wonderful attitude. You're enthusiastic. You're great to work with. You're a real team player. That's the feedback you receive. That's the feedback the students receive. Is this helpful? Anyone think this is helpful for a learner?
It's not helpful, so it's good to talk about it.
Yeah, why is it not helpful?
Because it's just generic and doesn't tell them what they're doing wrong or.
Yeah, there's no specifics. It's like you don't know any specifics you can tell them. So you're just saying, great job. They're probably happy to hear it. But I actually have to say that when I was a resident and I got that feedback, I was like, yes, I'm rocking it. Nowadays, Like when a student gets that feedback, they're like, okay, but how do I actually improve? Like the expectations are really different. So these comments won't help a learner develop concrete goals for improving clinical performance or future learning. We used to think of feedback as like positive and negative. Make sure you include something positive. Make sure you include something negative. Do a feedback sandwich where you do a positive and then a negative and then a positive again to like kind of make the negative like seem less harsh. That's actually not the way I would think about it. Like, yes, you want to include positives. Yes, you want to include negatives, but you don't have to include a positive and negative every single time. You can, but it's not critical. The way I like to think about it more is constructive and destructive. You want to give feedback, whether positive or negative, that's actually constructive for the learner. You don't want to make them feel bad. You don't want to be judgmental. You don't want to be destructive about it. I think really paramount to giving good feedback is that you have a good relationship with the learner, right? They need to be able to trust you. There needs to be some connection. David Brooks had a quote about this: students learn from people they love. Frame is really important. So you, as the person giving feedback, and the learner who's receiving feedback need to be in the right frame. If the learner is really anxious, really stressed, if you're really anxious or stressed, or like the student did something that you really disagree with and you're really upset about it, that might not be the right moment to give feedback. Feedback is something that you want to be careful with your words. You want to make sure it's constructive. You want to make sure that both of you are in the right frame. So there's something called the elaborative approach versus the directive approach. The elaborative approach really means that you and the learner are both kind of working together in this feedback conversation, and there's self-reflection, and that feedback you're giving is specific and non-judgmental. Okay, so elements of giving feedback. Number one, set the stage. So the feedback process should really start like the first day you work with a student or a junior resident. So the first day, you should establish what the goals are. You should establish what the communications are. You should let them know they're going to receive mid-clerkship feedback after a few days or in a week. You should announce, and so that happens from the first day. Then when you're giving feedback, you should also set the stage. So you should make sure that it's private. You don't want to give feedback to someone. I just gave feedback to Ashley in front of like 13 people, but that was a little bit more of like a demonstration. When you're giving feedback to someone, often it should be private. You should pull them to the side. You should make sure that you're both in the right frame, that they have time. You don't want to do it when you have like a second, right? You want to have a few minutes to be able to give feedback. You should announce that you're giving feedback, because sometimes people receive feedback and they don't hear the word feedback and they have no idea that they got feedback. And so you want to just say the word. Next is timing. So ideally, feedback, as long as you're both in the right frame, should be immediate, right? That's when you remember what to give feedback on. That's when the student remembers what they did specifically. So as immediate as possible. It should be frequent. So you want to like give informal feedback throughout the week, and then you could give a more like organized, formal mid-clerkship feedback in the middle. And as I mentioned, consider the frame. And then when you deliver feedback, first of all, you should prepare. Take a few notes. You know, talk about specific points you're going to want to discuss. First thing you should do is you should say, hey, it's been, we've been working together for a week. Ask them how they think they're doing. How has it been for you? What do you feel like you've done well? What would you feel like you want to improve on? That's a common question I ask. So really get them to self-reflect. And often they're going to come up with stuff. And they're going to say, well, I think I'm doing pretty well, but like the neuro exam is still pretty tricky. I feel disorganized. I feel like I miss things. And then that's often like something that you actually wanted to talk about. And then you could be like, yeah, I've noticed that. And then you can kind of go into it a little bit more. So first thing is self-reflect, then you can reinforce, Or if they're like, I am absolutely wonderful, I'm probably the best student who's ever rotated on neurology, there's literally nothing I could improve on. Like if you get that, first of all, like, wow, that's amazing. I don't think, no one should ever say that. But then you can refute it. And you could be like, yeah, you've definitely done some things well, but let's also talk about some things. First of all, everyone can improve. And let's talk about some things that you can make even better. When you're giving feedback, be specific. Don't talk about generalizations. Give a firsthand example, something that you've seen, right? Their specific presentation they gave, a specific history that you saw them take. Be as specific as possible. Be objective. Describe observed actions and behaviors, right? And similar to that, make sure it's actionable. So we shouldn't really give feedback on personal attributes, right? If someone is shy, don't say, you're doing a great job, but you're too shy. That is not, that's a character trait, right? That's really hard for someone to overcome. You can talk about the shyness. You can say, when you're giving a presentation, it's hard to hear you. Can you speak louder? That's very actionable. That's something that a student can think about and actually improve on. Or you can say, when I asked the group to answer a question, I've noticed that I haven't ever seen you raise your hand. It's kind of saying like you're not really participating enough, right? But it's saying it in a way that the student can really understand and can figure out how to improve. So they know, yes, I'm shy, but if I should raise my hand more and I should push through and try to do it. Any questions about that? Okay. Again, when you're delivering something, you want it to be constructive, not destructive. There's a whole bunch of things of ways to give feedback. I mentioned the feedback sandwich. That's not recommended anymore. Ask, tell, ask is a good way to do it. Essentially, you ask someone how they're doing, how they think they're doing, then you let them know how they're doing from your perspective, and then you ask them if they understand. That's a great way to give feedback as well. Similar to the reflective feedback conversation, honestly. But we at Downstate, we generally are recommending this, where you ask them how they're doing, you refute or you agree, and you kind of start that discussion. And then afterwards, you make a plan. And so I think it's a really good question to ask, do you have any questions about what I said? Do you understand what I said? Can you summarize what I said to make sure you're both on the same page? And then talk about a performance improvement plan. And what I often do is I'll often ask them, so it sounds like you've identified that you want to work on the neuro exam. How do you feel like you can improve on that? And see what they can come up with. And then once they come up with things, again, you can like agree with them, or you could say that's one possibility and then give other examples, right? Say, maybe you should practice with your peers. You should do the exam on me, make sure it's observed. I'd be happy to watch you do a full exam over the next few days. And we can really work on that. And then ideally, you want to like set up a follow-up. So you want to say, let's meet again in 2 days and discuss, what we talked about and the performance improvement plan we talked about. And then we can see if you kind of like improved, how you feel about that, and we'll circle back. And then you do it again, right? You go through all of the parts of feedback once again. Okay. Does anyone have any questions about the self-reflective feedback conversation? The PGY3s and the PGY4s are going to be using this when they give feedback in a case during the OSCE. Questions, thoughts, comments, concerns, accolades? I'll take it all.
Can you share the slides?
Yeah, I'll share the slides. Okay. Did everyone see the videos from last year? Do you want to see the videos again? I don't need to show the videos again. It's up to you guys. Anyone remember the videos?
I remember the videos. Maybe the links to the videos?
Sure. Well, when I send the slides, the videos are part of it.
Okay, perfect.
Okay. Maybe we can do like one video and just, I'll call on somebody.
Let's do a video.
Let's do a video. Feedback scenario 1 needed a lot of help. Let's do number 2. Hi, Dr. Jacobson-Dickman. Now that the rotation's half over, I'd love if we can briefly talk about how I've been doing.
Absolutely. Would now be a good time?
Yeah, now would be great. Thanks.
So, Nuri, how do you feel things are going so far?
I think, well, I feel I do a good job developing rapport with patients.
Completely agree. There was one case yesterday that stood out where the patient seemed quite nervous. Your presence really seemed to calm her down. One thing I have noticed is that you can be a bit shy, especially when there are a lot of people. I know that you know everything about your patients and execute your plans very well. It would be great if others could get that impression too. It might help if you can try to be a little less shy. How does that sound?
I think that's a good idea. You know, I've always struggled with shyness, but it's something I can try to work on. Thanks for your feedback.
My pleasure. Let's plan to meet again sometime in the next week to see how things are going for you.
Okay, so let's see who is listening to me for the last 5 minutes. So what was done well? First of all, what was done well? Was there anything good about that?
She asked your opinion on the feedback she gave you. She
Yeah,
wanted you to
she-
think about it.
She confirmed, she asked afterwards, like, how do you feel about that? I think that's a good thing. Anything else you do well?
She set aside some one-on-one time.
She like confirmed I was available. It was one-on-one. She gave feedback. That's like a great first step, right? Anything else?
It was actionable feedback.
Was it actionable feedback?
A little bit. I mean, she told you were shy, so I guess you could infer from it that you should be more outgoing. She didn't give you.
Be less shy.
Liz wasn't listening.
Liz wasn't listening.
I was listening. He said, "Oh yes, I am shy. It's been a problem."
No, to before that. I had said that you should never say that someone's too shy because it's not actionable.
Got it. Ah,
You did great.
understood. Now
Okay.
Mimo's laughing at me.
Well, this is why repetition and learning is really important, because you need to present the information in multiple ways for any learner. Oh my God, my dog woke up from his sedation and he's going to be barking a lot now. My dog has a herniated disc, and so he's in a crate, and he is a terror to begin with, and he's never been crated before. So now he's like a real terror, and he has to be in it for a month. So he's on high doses of gabapentin and trazodone around the clock. But around 1 p.m., the morning dose wears off. So we'll be ending in a minute or so. They also, the other thing she did well is that she asked me how I thought I was doing. Right. So she did elicit self-reflection. So that's something. Okay. What could she do better? Let me get rid of this.
Also, she did bring up a specific case.
She what?
She brought up a specific case that the student took care of.
Yeah, that's right. She actually had an example, and I think that was a real praise yourself. What did she not do? She really talked about shyness, and she didn't really plan a performance improvement plan or set up any follow-up. So I think that's what she could have done. Okay. Anyone have any questions? Okay. Good luck on the OSCEs and the OSTEs. It's formative. It's low pressure. but it'll hopefully be a good learning experience. And I'll see you all there. I'm going to go medicate my dog. Bye, everyone. Thank you.
Bye.